Dr. Vijaybhasker, Masters in Orthopedics. Today we are going to discuss about sciatica pain. Sciatica pain is heard from many people who are adults suffering a pain starting from the back of the spine and dragging down to the lower limbs. That is called sciatic pain because the nerve which is coming out of the back bones, that is lumbar and sciatic bone. These are the 1 to 5 lumbar bones, and a group of composition of 5 bones is called sciatic, that is sacral bone. So you see that there is a central canal with a spinal cord which is coming up from the neck in the brain base. From there, the spinal cords track down and it gives out two nerves. One is right and one is on the left. These right or left nerves form together in lumbar area, that is the back, and then sacral area, that is in the pelvis, are 10 nerves together become a thick cord nerve which is tracking down the buttock, posterior aspect of the thigh, and down to lower limb. That is called sciatic nerve. So when there is a nerve irritation or inflammation or biomechanical pressure on the nerve root in canals or posterior to the disc or posterior aspect of the vertebral body. So you can take it for granted this is the disc which is act like a shock absorber. This disc has a peripheral ring and centrally a gel-like tissue. So when there is a peripheral ring is burst open or ruptured on the posterior aspect or back of your backbone, where the disc material like gel-like tissue protrudes out and puts the pressure on the nerve root. Whichever nerve root is being compressed biomechanically, that nerve presents its significance in pain, which is determined in the lower limb. So the nerve root number is supply its impulses into the various parts of your lower limb. So when there is a L5 root is compressed, L4, L5 root is compressed by a disc or any other cause, then the leg and foot ankle area, certain part of the motor and sensory part will be affected. So the back pain dragging down to the lower limb on the back of your thigh and buttock is called sciatic pain. So we should rule out the cause for the pain. Then we have to take an X-ray, CT scan, MRI, and certain blood tests to rule out cause of the pain. And according to the cause of the pain, we should treat the back pain or sciatica pain either by a medication, physiotherapy, and if necessary epidural injections, and sometimes a surgery to the disc prolapse or any other cause, or putting the pressure on the nerves. So the sciatic nerve is compressed by a mechanical cause or any other cause, should be treated, the source should be treated, and then the sciatica pain comes down.